Good afternoon, everyone. We'll get started at 12:05. Hi, thank you for your patience. A couple of more minutes. We had some technical difficulties. We'll be right with you.
Uncle Baba.
Good afternoon, everyone. Sorry that we took a few minutes to get started. WebEx is kind of having some challenges with having a whole lot more traffic than it typically does. So we had to create a new link for people to then log into. So thanks for joining us this week. I just have a couple of quick things, and then I'd like to briefly talk about the Appendix K and provide some information, some updates and information on that. First of all, as you know, we have a meeting in the morning with community members, and just a couple of the issues that they raised, I just wanted to make sure that we were all on the same page. One of the questions that came up from them related to the role that people play in decision-making about activities in the home, and just sort of a reminder that as we have this really sort of difficult and challenging time about how are we spending our time when we have this stay-at-home order and we're in all day, you know, to make sure that the people that we support, first of all, understand what it's all about, and secondly, that they're able to play an active role in making decisions in the house about what the house can do. Because while people, as you know, the order says can only go out to engage in essential functions, included in that is also going out for recreation with just the people who live in the home and ensuring that those people maintain safe physical distance while they're doing it. But most importantly, I think, is really engaging with the people in the house about how they're going to spend their time. The other issue that certainly keeps coming up, and I'm sure we'll talk more about this, and in fact, DC Health will be on the line soon, and we'll talk more about it, but regarding personal protective equipment, they'll be talking about recommendations in the homes in terms of what kinds of measures are taken when someone tests positive and what kinds of measures need to be taken just regularly to ensure everyone's health and safety. I also would just like to remind people, if there's a person who has tested COVID-19 positive, or if they've had direct personal contact with someone who has tested positive, an RI should be put in. If they're hospitalized, then an SRI should be put in. And we will be sending out guidance for people so that you can enter an RI if a staff person has tested positive or had a contact. I expect we have questions about this, but I also wanted to just give people an update on the Appendix K. So the Appendix K currently, there's one unified Appendix K for the IDD as well as the EPD waiver. The mayor's office is reviewing the Appendix K along with other Medicaid funding decisions, and so as soon as we get that back, it will be submitted to CMS. However, the effective date of the Appendix K is retroactive to March 11th. And so what I wanted to share with you today, and we'll send this out in writing afterwards, are the elements of the Appendix K that we've either discussed with CMS and they indicated at that time that they were comfortable with them, or that we see have been approved by other states, so that we make sure that people are at least making the adjustments they can as timely as possible. So first of all, we've been making efforts to expand the use of virtual or remote technology for services, keeping in mind that all use of virtual or remote service delivery must meet the person's level of need, be approved by the person and their support team, meet all health and safety needs, and be documented in the ISP. Let me just say, we've said this, I think, each week. It's been our experience that service coordinators have been very responsive, have been getting these changes made timely. If there are any concerns with that happening timely, please contact the service coordinator supervisor, and also feel free to contact the Deputy Director, Winslow Woodland, at 202-730-1618. It does require a change to the ISP, but we should be able to do that quickly, remotely. Just, if it isn't happening like that, please make Winslow aware of that so that he can help move it along. The services that are available in the waiver remotely instead of face-to-face would be in-home support, companion, supported employment, supported living periodic, behavior supports, paraprofessional and professional, service coordination, monitoring, and ISP, and incident management at the discretion of the IMEU supervisor or the designee. Another change is expanding our settings where services can be provided. So companion services can be provided by the residential provider should that provider be an approved companion provider. Respite services may be provided in any setting to ensure the health and safety of the participants. Day providers that are also residential providers can use day staff to cover residential shifts if the day program is suspended, as long as they ensure compliance with any labor agreements. Required staffing ratios for a participant, as outlined in their ISP, can be modified to allow the participant to receive services in a safe and accessible manner, and such ratio changes must ensure the participant's needs are met and must be documented in the ISP. A service coordinator can review the current level of need and extend the efficacy of the current annual level of care for the next 12 months. The annual physical requirement can be extended by a period of 180 days if the participant is recommended not to travel to the physician's office or clinic by their physician or support team. Some changes in incident reporting. The IRC, in conjunction with the IMEU supervisory investigator or designee, will make a determination on the level of risk or harm to the person involved in reported incidents and whether an immediate face-to-face follow-up visit is required. Face-to-face follow-up can be extended virtually, such as utilizing Skype. We do have two investigators who are continuing to see people personally when that is required. The IMEU supervisor or designee and service coordinator will review all reported incidents within 72 hours to determine whether employees who are targets of an investigation may return to work. Investigations will be reviewed by the supervisory investigator and service coordinator to determine if an extension of the time frame for closure is required to ensure that all evidence can be gathered relative to social distancing recommendations during the public health emergency. Regarding ISPs and service monitoring, the service coordinator will monitor services through a minimum of monthly contacts by phone or virtually, such as using Skype. The annual ISP meeting can be conducted electronically and with the agreement of the participant to update and certify the expiring ISP as the new ISP. The service coordinator, in consultation with the team through phone call or virtually, may decide to extend the efficacy of the current ISP for 1 year for individuals with no change in support or service needs. For people with service or support need changes, the ISP will be amended or modified. Regarding provider training requirements, currently approved supported living, rehab, and host home providers shall be considered qualified to provide companion services. Staff qualified by one agency may begin working for another agency during this emergency. There have been changes regarding training to allow people to be hired without first, to begin working without first completing phase 1 and some phase 3 trainings. So many of the trainings in phase 1 can be completed within 45 calendar days of the end of the public health emergency. So, you may be able to do them over the course of the public health emergency, or once it ends, you have 45 additional days to do it, with the exception of 3 that must be completed within the first 14 days of a person's employment, which would be incident management training, introduction to human rights, and introduction to DD, keeping in mind that you may be hiring a lot of people who are very new to this field. Phase 2 trainings, which are really training about the specific person, must all be completed within 14 calendar days of hiring. And then phase 3 trainings, there are some adjustments here. CPR online is acceptable, but in-person must be completed within 45 calendar days of the end of the public health emergency. All online certified staff must work directly. This is true for all the training. Until someone is fully trained, they have to have a person who is fully trained working along with them. First aid online is acceptable in the same way. Universal precautions and infection control online is acceptable. But the in-person training must be done once the public health emergency is over. Behavioral intervention procedures, for example, MANT or CPI, this cannot be done virtually, and so no untrained staff can work with people who require CPI or MANT. OSHA requirements for people online is acceptable. Fire and safety, the same thing. HIPAA, same. TME apparently requires in-person training. This training is certified by DC Health, and so that's not something we could waive. Adaptive equipment product maintenance and recognition of prevention of and obligation to report can be done online. And then phase 4 training must begin within 45 calendar days post-emergency. You will note what I have not referenced here are any of the items that relate to payments, because those are being decided by the mayor's office right now. And as I've said before, what we're looking at, as you know, are issues related to, we are aware of overtime payment that you're making. Some people are having to use staffing agencies, special provisions for circumstances under which a special rate might be available, and the retainer rate for day providers who are unable to continue providing services. And as soon as that is available, as soon as the Appendix K is approved and submitted, we will publish it, but we will send out what I just reviewed now after this meeting. So now, actually, DC Health has joined us today, and Sharon Mebane is here, and she can introduce Dr. Sharon Lewis. If we can ask Sharon if you're available, and we have you unmuted.
Can you hear me?
Yes.
Can you hear me? Okay. Hi, yes, I'm Sharon Mebane. I am the program manager at the Intermediate Care Facilities Division here at HRLA. And on the line is Dr. Sharon Lewis, who is the Senior Deputy Director for HRLA.
Good afternoon, everyone. Can you hear me? I'm not sure if I need to be unmuted.
No,
can you hear me?
We can hear you.
Okay, great. Okay, great. So good afternoon to all. And I first want to start off by thanking all of our providers and the hard work that you've been doing to keep our clients safe here in the District of Columbia. And I must say these are uncharted waters. It's something new for us, but as of March the 11th, as you know, our mayor did declare a public health emergency, and in response to the continued spread of COVID-19 here within the District of Columbia. And then subsequent to that, you know, there were other orders that were issued by the mayor, such as the stay-at-home on March 30th. But what I would like to stress as we continue to take care of the clients within our community are a couple of things. And what I find that is most helpful to begin with, and we'll talk about some of the more concerning things that you do have, is that first and foremost, what we're finding out is that we need to make sure that all of our providers have conducted proper training for all of their staff, especially the direct care staff. And when I make reference to training, what I'm talking about is not only your usual infection control practices, which everyone should be employing, you know, your proper hand washing and proper PPE, as we know that sometimes it is of concern today to make sure that you have adequate numbers of PPE, but also learning about this novel coronavirus, also known as the COVID-19, and being aware of not only what the virus is all about, but the symptoms that are also displayed if one may be potential positive for COVID-19. So with that, it falls hand in hand with the proper screening of the staff that come in contact with our clients, because I must say that I do appreciate the fact that for our group homes, we have made sure that visitors have been banned for a period of time for at least 2 weeks or more. So therefore, if our clients do become positive, then we have to think about how could that be. Is it from the direct care worker or anyone that's actually entering into the home? So with that, what is very important is to do the proper screening of staff. So I am going to say that what has been successful in many of our other long-term care provider types is to ask a series of questions and to also do temperature screening. But they would ask the staff that are coming in if they've traveled within the last 14 days, and of course, if there's a yes to that, where has that travel been? They would also ask questions like, do you have flu-like symptoms, such as a cough, a fever, or shortness of breath? Have you had any flu-like symptoms in the past several weeks? And then have you visited or been around anyone who has exhibited flu-like symptoms, or have you been around anyone who is known to be positive COVID-19? And if there's a yes to any of those questions, then one would need to stop and further examine with your administrator of your provider group what would be the appropriate step, whether or not that person should move forward and take care of the client, or should that person be held and need further evaluation maybe from their primary care provider, or whatever you would then dictate in your provider community. Taking a temperature is also a screening measure that many of our providers have employed. Some of them have the infrared, so you can just flash the your forehead, excuse me, or I'm sitting here in front of my monitor here, or using an actual thermometer that has the proper sleeve covering and making sure that one is wiping off the areas that are not covered with a proper disinfectant or alcohol that may be. So once again, the training and the screening are very important, infection control practices. I'm going to remind you that when, I think it was a couple of years ago, when Sharon Mebane and others did present emergency preparedness training to our provider community. And that was in your Appendix Z, emergency preparedness training for all provider types. And for our facilities, one of the areas that's discussed is actually being prepared for various infection types, and not just the natural disasters. So one of the expectations with that, as it talks about influenza, Ebola, and many other types of viruses in that document that everyone has in hand as it pertains to emergency preparedness, was being prepared with your PPE storage in your facilities. So as the DC Health does try to support as many providers in the district as we can with that PPE, and we have reached out to our sister administration, our Health Emergency Preparedness, especially for the providers that currently have positive clients in the home, that we are not the main supporter and provider of the PPE. That is your responsibility, but we will help with the PPE as we get our supply in. We do not get supply in every day. We, like you, have placed our orders, and we try our best to divvy out based on a priority level, and that's being handled by our Health Emergency Preparedness arm. We also have our epidemiologists, which of course we encourage everyone to reach out to, especially if you have a suspected positive client in the home, if you're beginning to see fever, dry cough, some of those symptoms. You want to reach out to our, to your physician that supports your provider community, but also reach out to our EPIs as they can make themselves available and provide proper guidance of next steps. So with that, Sharon, is there anything else that we need to share with the group?
No, but Epi is on the line. Emily Blake, if you have anything additional to say.
Can everyone hear me?
Yes.
Great. I guess the only thing I just wanted to add is that we have some guidances drafted They're in the vetting and approval processes. These guidance are specific to group home settings. So we just want to give everyone the heads up that there are going to be more resources that are catered to your setting available very soon. And we'll work with our colleagues in HRLA as well as in HEPRA to make sure they're distributed to all the appropriate parties.
And I must add that actually, if you can, as a provider group, to frequent our online resources here within DC Health as far as literature and guidance, because it's almost every day or every other day that we are actually providing additional information to make it available to you. And you would go on our coronavirus.dc.gov website. You will scroll over to resources and click down to health notices. And you will see that it's divided between resources for healthcare facilities as well as health notices. So even as of recent, as March 30th is the most recent document that was placed on the website, and it addresses the use of PPE at the appropriate times. So please take heed of the information that many of the staff here within DC Health have put together as a resource for you. I don't have anything else at this time, Sharon, unless you can think of something else we need to share.
I just wanted to let everyone know that my nurses will be contacting the ICF DONs and administrators today, the ICFs and the ResHab homes, just to get a sense of their screening processes. So they should be calling you today and no later than tomorrow. Thank you.
Okay, thank you very much. If there are any questions for them, if you can just type them in the text box. Otherwise, we can move on to the questions that we had gotten from people in advance of the meeting.
Okay. We'll get started with questions. If the CDC implements the requirement to wear face masks, given how difficult it is to acquire the recommended N95 or surgical mask, will DDS be able to assist providers with obtaining?
We could have deferred that question to the folks from DC Health that were just with us. What we have been telling people all along is that we follow the guidance of DC Health. DC Health will take into account any recommendations that come from the CDC. There has been no update as of yet regarding the use of this. We sent out, as I said in the introduction, we sent out all of the current guidance that we have from DC Health regarding the use of personal protective equipment. Importantly, the one piece of guidance is labeled conservation of personal protective equipment. Those providers who do have people who have tested positive and are caring for them know how important it is that we conserve this for when we need it.
What is the status of provider certification reviews, and if they are on hold at the moment, will certification expiration dates be temporarily extended?
Yes, they will be temporarily extended. They are on hold right now. At this time, they're on hold for a month. We appreciate not only, we talked with the PCR staff about the ability to do them remotely, but as we all know, this isn't just about their ability to do them remotely, but also your ability to prepare for them. So at this time, they're delayed until the planned end of the public health emergency for right now is the end of April.
What are Lifeline Partnership? We are a Lifeline Partnership, and we serve teens and adults with developmental disabilities in the Metro DC area. Generally, we do this through events that folks attend, both social and spiritual. We are planning on keeping in touch with our regular folks and the wider community through regular mailings of crafts and activities similar to what we would do when they come to our home events. Are there any concerns about this in terms of safety of participants?
None whatsoever. I assume perhaps the question is whether there's a concern about using the U.S. mail and the possibility that the virus could be transmitted by someone touching the mail and someone else picking it up. And I think we have the folks from DC Health unmuted. They could address this, but what we continue to repeat is the importance of washing your hands. So if you open the mail, before you touch your face, wash your hands thoroughly. And if DC Health had anything to add, please do.
Medicaid waiver providers who are not ICF providers are not subject to many of the federal rules in terms of employee pay and benefits. In light of the pandemic, when employees must be out due to a mandatory quarantine, how should this expense be covered? As a provider, would we be expected to pay the employee while out on leave in addition to paying the replacement staff?
I expect so. I mean, our current rate does include the expectation that staff could be out for a certain number of days. And, you know, as I said, you will get some more information about some of the issues related to paying for staff once the Appendix K is approved and published.
Given the medical requirements of hiring a new DSP, are there any waivers and door adjustment associated with this requirement? Personal care providers are not supporting standard physicals right now.
We are not aware of the ability to waive those at this time, but we are consulting with DC Health. I know they're on the phone. We just asked them yesterday when we reviewed the questions, so they may not yet have an answer to that either. But, you know, people have to show they're free of communicable diseases before they start. So.
In the matter with obtaining background checks, individuals are sent to local businesses to acquire fingerprints. Given the numerous closures, it's possible to authorize provisional work eligibility letters.
It is possible to find locations that are able to do the background checks currently.
Are we expected to maintain medical appointments to include quarterly, where necessary, lab draws?
No, as I had indicated, and you'll be, like I said, after this ends, we'll be sending you the Appendix K. Any medical appointments that are made, what you would need to do is reach out to the medical provider and talk with them about the possibility of delaying the medical appointment. If someone's going in for a routine medical appointment, the healthcare provider should make a decision about whether it is necessary for them to come in for that screening or not. In most cases, I think they're probably delaying it. So if you can just put a note that it's been delayed on the advice of the medical provider, then that's all you need.
Will we be cited during medical reviews when these appointments are canceled for safety concerns during this pandemic?
As I said, just make a note and you should be good.
Will DDS be willing to reimburse for in-home medical services when necessary?
When you have someone who needs to see a doctor, you should always call the doctor to talk with them about whether to bring the person in. One of the changes that has already occurred is really a real flexibility and expansion of telehealth. So the doctor may be able to consult with the person via Skype or, you know, some other technology that would not require the person to go into their office.
Do you have any guidance in terms of applying for loans, grants for business operations during this crisis to assist with managing additional expenses?
I mean, I would just suggest that you refer to federal resources that are being offered. You know, we all watch the news. We see what's been described from the CARES Act, the Families First Act that just passed. The Small Business Administration is managing it, but I think that it's taking them a little while to get information out because my understanding is it has to go through your bank and most banks don't yet have that information. But that's where you need to go to get the information.
I think DC Health gave a clear step-by-step description of what happens when folks contract COVID-19, so I won't ask this question.
I do want to respond to it, though, just to say, to date, I believe the coordination with DC Health and providers has been excellent. You know, providers have contacted DC Health. They've been on the phone with the provider, with DDS, making sure that plans are made for the person, and we expect that's what will continue to happen. And as Dr. Lewis had indicated, you know, it's important to contact them when you have a suspicion of or a confirmed case of COVID-19 to contact the EPI folks. You can also call Sharon, and Sharon will tell you you need to call the EPI folks. But DC Health has been very good at coordinating with us and coordinating with the providers.
Since this is a rapidly escalating emergency situation, what is DDA's communication plan used to inform the provider community of facilities that have confirmed cases of COVID-19?
So we don't share individual health information about people. And so we wouldn't be sharing publicly where people live who have been diagnosed with COVID-19.
How are you helping providers obtain more PPE, especially N95 or regular masks? We've answered that question. I would like to know if house staff or managers in supervised apartments and group homes can be asked to link Zoom to the on-site computers so persons can receive their therapy via teletherapy.
So this, I believe, is coming from a clinician who's essentially, I guess, asking providers to help facilitate the availability of telehealth for people. You know, especially if it's teletherapy, I think it's very important that we do everything we can to continue someone's therapy. Teletherapy is available now, and I would hope that the homes that people are in could have the technology they need to facilitate this. I know when we're paying for the residential supports, Wi-Fi is certainly available. It's just an issue of having either an iPhone, a tablet, a computer that you can Skype through, or, you know, some other technology so that you can be able to see the person and speak to them. But we would really like to encourage people to take every advantage of continuing as many of the services that you have.
Our next question is about remote supports as well, related to physical activities. Many of our clients have been asking to do personal training remotely via phone, tablet, or computer. We have primarily called clients and spoken to their families, residential providers, to get them set up to be able to be trained. Can we train clients remotely if the client is interested? The recommended amount of aerobic physical activity is 150 minutes per week. Due to stay-at-home mandates, most of the clients they're not getting physical activity. Please advise on how we can proceed.
So first of all, I want to remind people that stay at home does not mean that you can't leave the home to walk around the block, to exercise, to get some kind of recreation there in the neighborhood. So people shouldn't just be sitting at home, ideally. And in direct answer to your question, yes, that could be available as long as the team considers whether, remote, whether the kind of support that's provided could be provided remotely. Some of the people that we have who get fitness require a person to have hands-on with them. And so in those instances, of course, it possibly could not occur. But to the extent it can occur remotely, then absolutely that is something that could be done.
For those individuals placed on AbilityOne jobs, how is RSA counselors going to verify the placement due to COVID?
So there has never been a requirement that an RSA counselor, there's an assessment that's done of whether a placement is integrated and competitive. And there's never been a requirement that the counselor go to the location to confirm that. They have to speak with the employer, gather information about the work that the person's doing, and through that, they will be able to assess whether it's an integrated setting.
So that concludes our questions that you all previously submitted. We'll review your questions from the chat box now. As we continue to learn about this virus and potential spread by those who are asymptomatic, what does DDS plan to address the need for masks? Currently, all sites have indicated that supplies are reserved for healthcare workers and government agencies. We've addressed that.
So, as we've said, part of the plan that was submitted by every provider should have included what they're doing about personal protective equipment. We have referred all of our providers over to HEPRA for assistance in identifying what their needs are and getting support when they do need masks appropriately. And once again, I want to remind people we sent out the guidance from DC Health regarding the use of personal protective equipment. Please review it and review it with your staff.
When can we get those training requirements in writing?
As I said, I'll be sending them out, or will be sending them out right after the meeting.
Can DDS provide a list of any business entities which you referenced that are still doing criminal background checks?
We'll look into it. I mean, have people checked with the one they typically use? Because I know the ones that we use, there are a number of different locations that a person can go to. I don't know for each provider what system you use for getting background checks. The clearance system that we use in DC, while some of the locations were not essential businesses, they also included UPS stores, and those are essential businesses and are still in operation.
So DDS paying for remote therapy, occupational, physical, and speech therapy, I was told currently it was not. What are the parameters to effective distance services, and where is this documentation located?
So with regard to the occupational speech therapist, I know I did speak to a physical therapist, and as Director Reese has stated, to the extent that the person can receive these services safely and the team who typically supports the person in the ISP is willing and on board with that person receiving it, they absolutely can receive those services. But keep in mind, some of our people serve. This is why we're not doing that blanketly. Some of our people have communication needs. Some of our people have specific safety concerns, making remote occupational speech and physical therapy not viable to them. So you can call me at 202-730-1618 if you have a specific person or concern, and I'd gladly walk you through that.
Will providers be reimbursed for the additional PPE bought?
No.
No.
I mean, at this time, I don't think that's part of, we do have, you know, included in our human care agreement for the waiver providers, there are funds available for medical supplies. To the extent this becomes an issue, we can discuss it, because there's also the other line for additional expenditures. Right, and keep in mind, we are doing cost reporting right now. And so people could record what all their costs are so that we can identify, you know, whether the PPE, because some of the costs that people are being paid for now, they're not going to be able to do. You know, if people are getting money for clothes, unless you're ordering them online, you're not going to be able to purchase clothes. you know, there are other funds in the human care agreement that aren't being expended right now and perhaps could go toward that.
How will we remain in compliance with DCHF regulations? DHCF. I'm not really sure.
To the extent that you should be continually supporting the person, the ISP should be followed to the letter as closely as possible. You should be responding to issues and incidents as you can. We are, and as we mentioned in our first call, we're not going to be, you know, we're going to be as flexible as we can, but we can't just give up on our remediation strategies. That would be incident reporting and issue remediation. So if you have a specific concern regarding issues, incidents, or any other DHCF requirement under the waiver or the Department of Health, you can call me and I'll reach out to my partners at Health for those that are not in our purview. But with the waiver, we're being as flexible as possible. But keep in mind, we're still providing services, billing still is occurring, our staff are still being paid and expected to work.
And we do have DHCF staff on the line. If they're not muted, they may be able to respond to that. Give us just a second so that they're not muted, if that's.
Mary's unmuted.
So Mary, we've unmuted you.
And Aisha.
And Aisha.
And Amanda.
And Amanda, if you have anything to add regarding a concern about compliance with DHCF.
Yeah, this is Amanda. Can you all hear me?
Yes.
Okay, so in terms of compliance with DCHF regulations, I mean, I think that as you all just heard from the DDS folks, we expect that you continue the providers continue to comply with the regulations unless they are, unless we provide guidance otherwise. I know that there have been some provider bulletins, and we will be continuing to post some additional things on our website after the Appendix K is submitted. Again, the provisions in the Appendix K are essentially waivers of requirements that are otherwise in place for the duration of this emergency. So if there is a regulation that's not explicitly waived or suspended for the emergency, then providers will continue to comply.
Thanks, Amanda.
No problem.
So also, if, sorry about this in terms of muting and unmuting, if Sharon is still on the line, someone has asked if we can provide the phone number and the email to notify when a person is diagnosed with COVID.
Or our partners from EPI. Is there anyone on from EPI still who can provide a phone number?
This is Dr. Selenicchio at EPI, and I can provide a phone number. That number is 202-557-9565.
Thank you very much. And of course, you should also be notifying DDS when you learn of this.
So just to repeat, that number is 202-557-9565. That's the contact number if anyone has been diagnosed with COVID. And as well, to ensure you contact DDS as well. You referenced the physical implications of the crisis were being reviewed by DHCF. What has been recommended. When will the providers have some clarity on what exactly will be covered? And how will those calculations be reconciled for the ICF and the waiver providers? What is the plan on the financial aspects?
So actually what I said was that it's being reviewed in the mayor's office. Our communication with the mayor is between us and the mayor. So as soon as we have the approved information back from the mayor's office, we'll make it public. We'll be submitting DHCF, we'll be doing a submission to CMS, and we will publish it at that time.
Are there any other questions?
Oh, here's one.
Okay, well.
Yeah, so read that question because this is a concern.
Oh, can you see that? Okay.
Fitness service providers and the trainers who contract for them work directly with DDS clients in person. Many in-home support services are restricting personal trainers' access to their clients, even though outdoor physical exercise is an acceptable essential activity. If a fitness service provider or personal trainer runs into this issue and the client is not ideal for remote training, how should the service provider or personal trainer address it?
Actually, I think that should be addressed by the team because the reality is the reason I expect that a provider would be limiting the fitness person's access to the person is the instruction that's been given to limit visitors to the home, to limit the number of people with whom staff and the people we support are having contact. So that's why I say if it can be done remotely, that's great. If it can be done remotely, that would be wonderful. You can carry an iPhone into the community. Going outside and doing the activity would be a wonderful way to engage in fitness, but having additional people in the home could be a problem. This is one of the reasons when we've looked at fitness in the waiver, we've really focused on ensuring that not only is the fitness provider teaching the person something, but that they're teaching them things that they can then continue to do on their own, that they're teaching them and teaching the DSP, so that hopefully through some of the work that you've already done, they and the DSP could be able to go outside, because as I said, the stay-at-home order doesn't mean people can't leave the home. And so if there are any concerns about an individual person who needs services, do feel free to talk with the service coordinator, their supervisor, or to give Mr. Woodland a call at 202-730-1618.
Okay, this question is for DC Health. Can we use a KN9 mask?
And Dr. Lewis and Sharon, you are unmuted, as well as Epi.
I'm just going to ask, if we don't have someone from DC Health who's available to answer immediately, ask people to please go back and review the documents we sent yesterday about the use of personal protective equipment. That goes for that question. And the next question, can staff wear masks and gloves given that people are asymptomatic? I expect that's a question about a concern that the person they support could be transmitting something to them. Goes both ways. And this is the reason for making sure that we're screening staff when they arrive to work each time, making sure that they're not feeling ill, that they haven't been traveling outside the country, that they don't have a fever, all of the things that Dr. Lewis reviewed. Masks and gloves in working with people who are healthy, especially where you're able and should be keeping an appropriate distance. The need for those or the lack of a need for those is addressed. There may be circumstances where certain protective equipment is required based on the person that you're supporting, their needs and their abilities. But please do review the guidance that's been provided.
There's another question that came in here for DDS.
I would like whoever wrote that DDS has told fitness to cease to call me, because that's not what we said. And I'd like to know who you spoke to specifically. 202-730-1618. You can call me. I'm in the office today, and I'll speak to you personally on that one.
Next comment is that CDC has recommended that cloth masks may be used.
First of all, I'm not aware of any updates to the CDC recommendations, but as I have said, we're following the DC Health recommendations that will take into account guidance provided by the CDC and the current status and the evidence in the District of Columbia.
Appendix K will list specifics to teletraining with regards to wellness support, correct?
No. No, it doesn't, because many of the telehealth provision of services isn't about what's included in the waiver. It's about the individual profession's ability to provide that service remotely.
Just consider that every service provided is not spelled out specifically in any guidance in the waiver. It is spelled out in the individual's support plan, and that's what we need. We need assurances that person can, first of all, should have that service through telehealth or remotely, can be safely provided that service, and is likely to benefit from it.
What I will say is encouraging in some regard is, at first I was thinking, wow, this is a lot of questions about fitness, but at the same time, everyone is stuck inside. And so we really do need to be looking at how can we be helping people to get some physical activity in, to get out, to move around, to be doing something, because being inside and not doing anything is not healthy either. You know, to the extent people are able, we should be continuing with some kind of fitness.
And also, the in-home support providers and direct support staff should be more than capable of assisting people with walking around the community. And I don't want to believe that we've been authorizing fitness services to teach people how to walk. And that's why I'm reluctant to free that up, because my expectation is a fitness trainer is providing exercises and supports that are targeted to the person and should be training that person with a hands-on approach, watching that person do the exercise correctly or incorrectly. And I would not want that to be through a phone.
You have.
Unmuted.
I want to be clear. I'm not saying that witness is not appropriate for remote. But we have some very significant people with very significant mobility challenges, communication challenges, behavioral challenges. So that's why I want you to talk it through with me and my teams and ensure that the ISP supports that. Not blanketly saying no, not blanketly saying yes.
Okay, thank you very much. Sorry we were a little late getting started. As a reminder, we have recorded this. It is posted on our website, will be posted on the website, and available for people to listen, or you can let other people know who didn't have an opportunity to attend. We will be convening again next week. The other thing that I would like to figure out is for us to have the opportunity in these calls to raise questions to which providers could provide the answers. All of us are in uncharted territory right now. I don't think anyone has dealt with this kind of an emergency in the past, and it is all of you who are on the ground learning every single day about how to deal with this. And so what I'd really like to do is figure out, and we'll send something out to you by the beginning of next week once we do figure that out, how we can provide a real, as we learned the first time, we can't just open up the phones and have people talk to each other because technologically that's an issue. But what we'd like to do is have some opportunity for people to be able to ask questions, get answers from each other, to share best practices that are being developed on the ground as it's occurring. I know that some providers have been doing that, and I've heard some of what providers have said that have been excellent best practices. Just a small thing that came to mind was right at the beginning, a provider that mentioned that they were able to organize so that their staff would be limited in the places where they worked, so that we don't have the issue of a staff person going from one place to another. But it is all of you who have learned these kinds of things. And so, like I say, we'll send something out early next week so that we can figure out a way to make this interactive between all of you, because certainly we don't have the answers, and you all are in the process of learning them, and my hope is that as each of you learns, you will be able to share that with each other. So thank you really for all the work that you're doing. I also want to give a shout out. So this week we had a couple of really challenging cases that came to light of people that didn't fall within our scope typically. And as I said, the district has a unified response on this. So a call went out about where could we find providers who could give support, in this instance, to some children whose parents were in the hospital. And the children also tested positive. And it was our provider community that stepped up. And that doesn't go unrecognized. I really see how hard you all are working to figure this out and the support that you need from us. And we are doing everything we can to provide the support that you're asking for. So we look forward to next week. If anyone has a good idea about how you share with each other, email it to me. Otherwise, I'm going to be expecting my folks to come up with something by Monday. Thank you.